from 10 to 11:30 a.m. with your host, Trudy Kristen, and co-host, pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
This morning feeling risky. I had been patience to call it sick, but I end up in Jolly's Pharmacy. And don't you got treat Jolly's system, my immune system. Me feeling fit and strong, now I'm ready to work on any mission. If you see me again, Jolly's Pharmacy is number one, Jolly's for you. We cater for everyone, Jolly's for you. Boost up the immune system, Jolly's for you. Yo, Dominic is the boy part of box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, they boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Introducing
Good morning, and welcome to another episode of Jolly's Health Vibes. We are on with you, as we always are on a Wednesday morning, aiming to bring you a health education talk show with a little bit of humor, a little bit of vibes, a little bit of energy. My name is Trudy, and joining me this morning in studio is Leona. Leona, good morning to you.
Good morning, Trudy. Again, good morning to all our listeners. Of course, again, happy to be here.
Yes, so this Wednesday, we have promised you a very interesting show. As a matter of fact, last week, I told our listeners to make sure the men are aware that Health Vibes this week is for them. So if you are listening to the program and you're a man, this program is supposed to be just for you. If you're a lady, the program is for you as well, because you need to get the information out to the men. We are each other's keepers, as we would say, right? So just make sure to stay tuned to this program. But we have a lot going on in store at Jolly's Pharmacy. So before we even get into the topic for this morning, I want to get our listeners involved in what's happening in pharmacy that they can be looking out for. There is a promotion going on this week, Fitzroy Products. If you are at Jolly's, any Jolly's branch, you get a chance to win some very interesting prizes if you purchase a Fitzroy product. So Fitzroy does tonics, multivitamin liquid tonics. If you purchase that this week, you get a chance to win. So on the 21st is today, Leona?
Yes.
Right. So for the people in Portsmouth today, if you purchase a Fitzroy product, you get a chance to spin the wheel and win. You can win backpacks, flasks, gift vouchers, visors, a whole assortment of things. So if you're in Portsmouth, today's the day to shop Fitzroy. If you're at Fokole and you normally shop at JP Mega, the 22nd, that's tomorrow, is the day for you. If you are one of the Great George Street people, Jacinta, good morning to you. If you're one of the Great George Street customers, the 23rd is your day to shop and win Fitzroy products. And the 24th for King George V Street. Leona, that's you?
Of course it is.
King George V Street people. So you get the chance to buy a Fitzroy product, spin a wheel, and win something for yourself. So that is the promotion going on this week.
Yes, and there'll also be sampling of the Fitzroy tonic at those locations. So for those of us who are trying to figure out, what tonic might be best for the entire family, that is definitely an option that would be great for your younger kids, for yourself. So step into the store, take a test and see if it's something that, might be good for your palate or your children would like. So feel free to walk in on those days at the different locations.
Definitely. So a little sampling going on, a little chance to win. So that's all this week in the different branches, as I have said. We have a lot more going on. No, Carnival is coming up. We're already starting to get the activity increase. Calypso is on. Calypso shows
What
are
an
in full
entertaining.
swing. Yes, Calypso shows are in full swing. We also have all of our, the normal Calypso controversy and so on has already begun. So you can tell Carnival is coming just by, by these things. So at Jolly's, we also trying to get you into the carnival spirit as well. So for people who do not know, Jolly's Manufacturing produces some very nice fragrances. I have smelled both of them, the one for the men and the one for the women. So it's linked fragrances. Alpha is for the men and Siren is for the women. I like the men's, I like the male. I mean, I even like it more than the women. I don't know what that means.
I guess it's effective.
I guess. I guess it's effective. So Alpha and Siren are the two fragrances produced by Jolly's Manufacturing. And this carnival season, if you purchase any of those two, so if you purchase the Siren, that's for the ladies, the Alpha, which is for the men, you're actually getting a chance to win a costume package from Hysteria Mass. So if you haven't joined the costume band, or if you wanted to join a costume band but you didn't get the chance, Hysteria is you can get a Hysteria costume package if you purchase either Alpha or Siren. Those are the fragrances by Jolly's Manufacturing. If you purchase either one, you get a chance to win that Hysteria Carnival costume package. So the deadline for you to enter that draw is February 6th and the draw date is February 9th. So Leona, you joining a costume band?
I'm not sure, but maybe the person who wins will gift it to me.
Oh, okay. So Leona, you're looking for somebody to win to gift you their costume. All right. I encourage all of you all to go out, try those fragrances. I'm telling you, particularly as I said, I love Alpha. That's the men's fragrance. I love it, love it, love it. You could purchase it this season, get a chance to enter that draw where you can win a Hysteria mask costume. So a lot going on at Jolly's Pharmacy as usual, always keeping it very, very interesting for our customers, always able to get something nice. All right. I see our listeners are coming on, those who typically view on the social media platform of Q95 FM, the Facebook page and the YouTube channel. I see you guys popping on. I want you to share the live, share the live, share the live. Good morning, Julie. Good morning, Ivenia. Good morning to Hazelan, always on with us. Good morning to Martina. I see you guys popping on and sending your messages. Good morning, good morning, good morning. If you are listening to us on radio, it's of course there are a lot of people, of course, listening on radio as well. You in your car, you in the garden, you are somewhere outdoors, and you have your phone or radio listening to Q95. Good morning. This is a show that I want you all to tell a friend about. We have two guests this morning, and we're going to be tailoring this show for the men. So what we're going to do, we're going to take a quick break. And when we get back, we'll let you know who we have. We have somebody in studio. We have somebody virtually. We'll let you know who are our guests. And we'll let you know what we're going to be talking about this morning. We'll be right back.
Make a big difference, and you can trust me. Not just where you should be. That is JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. If you got a with your sunshine, it's to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, nigga. You could be shopping and having fun. Get that to everyone. What a happy place. Oh, what a happy place. But just fix some more any item and you automatically qualify for discounts. Check us out at the Mega store in Congolese where there's lots of parking. On Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your host, Trudy Kristen, and co-host pharmacist Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you. As I promised, today's episode of Health Vibes is for the men. It's for the men, but ladies, we want you to listen so you can give the information to the men, or you can ask the men to tune into the show. So although we're focusing on the men, ladies, we cannot say don't listen. You have to listen as well, right?
Indeed. And we know men, so we need to be there for the encouragement for sure.
Definitely. I there's something I never knew until I started my master's in public health, and it was, I guess I kind of knew, but I didn't know that it was a precise science that men have the poorer health seeking behavior as compared to women. So men tend to avoid seeking health care, going to the doctor more than women do, right? So that's why we have a special show just for the men. And we have two male physicians who are very well equipped to discuss some of the things that are priority for men as it relates to their health. So in studio with us this morning, we have Dr. Johnson. Dr. Johnson is no stranger to Health Vibes. He's been on several times. And of course, anytime we ask him to share information, he always obliges and comes on. Dr. Johnson, good morning to you.
Good morning to you, Mr. Christian. It's nice. Thanks for having me with you on Health Vibes this morning, the Jolly Show.
Yes.
It's always a pleasure. We have done this a couple of times. But you look, say Happy New Year to you.
Thank you. Thank you.
2026 is doing a great thing to you.
I hope so. I hope for once. I hope for once a year does something great for me, Dr. Johnson. I mean, after all. Yes. Dr. Johnson, so great to have you on. And we also have someone virtually who is joining us on the program, and that is Dr. Devon Malcolm Brewster, joining us from Jamaica. He is on with us. Dr. Brewster, can you hear us? Good morning to you.
Yes, good morning. I can hear you clearly. Just trying to situate myself. But good morning to you. Good morning to your listeners. Happy New Year to you.
You're a bit low. I don't know if it's on your end or on our end, but let's take that again.
Yes. Can you hear me any better? Yes. Good morning to everyone. Good morning to your listeners, and Happy New Year to you.
Happy New Year to you as well, Dr. Brewster. And how are you?
I am doing pretty fine, and I'm glad to be here.
Good.
Yeah.
Okay. Dr. Brewster?
Yes, I'm here.
Okay. It's loud. Okay. I guess I'm the one having audio issues because everybody else is hearing you loud and clear. So I will tell you, good morning. Happy to have you on Health Vibes. I think for you, this is the first Health Vibes episode that you would have been on, but you also are no stranger to public health education. And so I am happy you have also obliged us and are on this program this morning.
Thank you very much for having me.
So, Dr. Brewster, do you want to give us, I think I will ask you to give us a bit of your background. As I said, first time on the program. So our listeners maybe want to know who is this Dr. Brewster that we have on virtually. Dr. Johnson, I know they know him. They know him because he's been with us several times. But Dr. Brewster, let me give you the opportunity to tell our listeners a little bit about you.
Okay, well, I am Devon Malcolm Booster. I am from the town of Portsmouth, last son of Mr. Julian Booster, former mayor of Portsmouth, and Nurse Julie Marion Booster, retired community health nurse from the Portsmouth Health District. I went to the St. John Primary School, Catholic education, yes, and then to the Portsmouth Secondary School, where I graduated as a student of the year, and then matriculated to the Dominica State College, and I did a triple major in biology, chemistry, and physics there. Miss Trudy Christian was one of my biology lecturers, and definitely one of the inspiration for me pursuing public health. I completed my medical education in 2022 from the University of the West Indies Mona campus, and now I just graduated with my master in public health. I work in private practice as a general practitioner and a concierge home service provider. And I am passionate about public health, and I'm glad for the opportunity to share with you, the audience in Dominica.
Yeah, so past students in the house, I am always very proud when my past students, and I've always been trying to tell people, everybody associated with Health Vibes too, past students. So Leona is here, past student. When Jacinta is on, past student. Dr. Johnson, you're not my past student, but you're my past colleague. Yes. So the connections are there. But Dr. Brewster, I'm so happy that you decided to go down the route of health, medicine, and now particularly public health. We definitely need as much as we can get of professionals in those fields. So I'm happy. I'm very happy. And congratulations on your graduation, which just happened. I'm very proud of you.
Thank you so much.
So we're talking about men, and I want to hear from both physicians. I'm starting off with this. What do men? I said they don't like to come to the doctor, right? That's what we've learned. They don't like to come to the doctor. But when they do come, what brings men to the doctor's office? What are some of the primary things you will see a man actually coming willingly to the doctor to get checked, or what could be wrong? Typically, I'll take that from both of you all in your practices.
Well, good morning once again to you, Miss Kristen, and the other co-host. As I say, it's always a pleasure to be on Q95 Jolly Talk Show. It's pretty interesting. And good morning to the listeners out there, or viewers, I should say as well. People viewing and people listening. And it's very interesting that you invite us to do this topic on men's health. A number of persons organizations also focusing on men's health. Before I do so, I wanted to preface the whole discussion in something that I actually read or looked at recently. It's a 2023 PAHO report, which actually, a very interesting report, which actually speaks about masculinity and men's health in the Caribbean. And what the report tends to do is aim to identify what you call masculinity, and to some extent probably harmful masculinity or toxic masculinity. There's also another PAHO report which speaks about toxic masculinity, and that one sort of indicated some years ago that 1 out of every 5 men will not live to see the age of 50 or 50 plus. So in that report, it tends to relate how masculinity and men have related to certain perceptions, behaviors, and outcomes, And masculinity in itself is the concept tends to capture a a number of ideas in terms of what sort of attitudes, the values, the function, the culture, the behavior that are essential in terms of what we define in men. Strong men. A man's supposed to be strong and in control, right? Not supposed to be weak. And that I think we spoke about some time ago, socialization. So men, as you rightly said, do not have, compared to women, at least some men, and for what we're discussing here, we're talking about not every man,
Yes,
but
yes.
on average,
On average,
don't
yes.
have this help-seeking behavior. Um, for a number of reasons, and that is mainly because of socialization and men supposed to project this sort of strength, macho. And if you go and see a doctor because you have a waist pain, Instagram say just a waist pain, because you lift up a bag of cement or some tiles or something. Okay, so men don't have this, at least in the environment which we're living in, don't readily see doctors except that they have to. And I'll tell you one thing. One of the things they'll come to see doctors for, don't touch that thing they call it the sex drive, the potency. So men will come to see you because, boy, that thing not working as it used to work before. Huh? That thing not working as it used to before in the sex drive. So, doc, give me something for that.
Okay.
So we're talking about sexuality.
Yes.
Okay. And so that's one that men will come to see doctors for. If they have pain, severe pain, what that prevents them from doing their work. If they have, and we'll discuss some of those things in more details. Men will come to see a doctor, for instance, if they have problem passing urine, urinating. So it goes back to prostate problem. So if I know, okay, what doc, when I pipette, for the general public out there, when I try to pass urine, it's burning me, it's hurting me, or I have to force a lot, or I was trying to pass urine and it stopped, or I see blood in my urine. Okay. So those are some of the general complaints, symptoms that men would come to see doctors for. In terms of pain, severe pain, some of them try to dismiss the pain as hard work. If you have pain in your chest, they'll think they might just be presenting with some sort of heart problem. But the chest pain, they figure, well, it's because I'm working hard, I pull muscle or gas, or gas. So those are some of the general complaints that men, when they present to you, will complain of,
Okay.
and then you could identify much more serious problems as we can speak about later.
Okay. Dr. Brewster, let me take that same question let me get a response to that same question from you.
Okay, so I definitely agree with my colleague there in terms of the general things that you would find men presenting for to a general practice as mine is. Two things I would say though is that first one, I would really and truly classify it as anything that has an immediate impact on functionality, right? And it's warped up in the perception of the man's role as a protector and provider. So insofar as something does not, you know, tend to disrupt the ability to do that. So, it might be a little waist pain, but the waist pain is not debilitating enough to prevent me from going to work. A general tendency of men is to, just wait it out. What I will say though is that I do see a fair mix in my practice because I do have some men who are very proactive in terms of their health, and they basically, are the model, patient, in terms of just being on top of the healthcare and so forth. So it's a fair assessment to ascribe that to the general population of men, but I do think that it is evolving, and it is, the reason we have conversations like this is to get more men to be aware of their health and the need to, go to the doctor not only when you have a pain, but also we need to normalize going to the doctor when there's nothing wrong. Especially after 40, you need to go to the doctor at least once a year, get your executive profile done, a general examination. And sometimes your physician will be able to detect things, or blood tests will detect things way ahead of time. Prevention is what? Better than cure. So, yeah.
And funny that you
So
say that, because I think that that is one of the things that we tend to forget. Doctor's visits aren't just when you have an issue, or you're facing some chronic illness or something that is preventing you from doing your work, as you say. But it's important that you are doing things ahead of time. You're checking things when you should. So when we talk about prostate, we're talking about the age of 40, like you said, so that you know those things, learn more about your health, talk to your doctors, talk to your healthcare providers, because some people don't know when they should start looking out for certain signs and symptoms. Some people don't know what some common signs and symptoms might be. So for the men listening, definitely information that you should take to heart, that you should at least visit your doctor once a year for a general screening.
So yeah. So Dr. My colleague is right. I mean, increasingly, and I must thank health education, health promotion, health discussion that we have for instance, the Jolly Show. So some men are becoming increasingly more conscious of their
More
health,
aware.
more aware of their health. I mean, because you have a health program every week.
Yes.
Okay, there are the media houses that have health programs. There's a lot of health promotion out there. So you will find a few men also coming to get checked, because it's a boy, look, they had somebody who died, or died of a heart attack, or died of some some lung problem, and therefore they come to get checked. So I think that is largely due because of the great work, for instance, that shows like these are having in terms of health education and health promotion. So men begin to have a better health seeking behavior. Yeah.
So we're seeing at least some
Improvement.
change, some improvement.
Yeah.
That's good.
And some men are religiously, particularly, well, if they have certain chronic conditions, they do come in regularly for the follow up as well.
Okay. Okay. I think I want to start off. There are three general areas I wanted us to tackle this morning, and this men's health topic will not be a singular show. We will try to do various topics relating to men's health as the year progresses. But one of the things, and Dr. Johnson kind of cued in on it, that I wanted to bring up this morning would be sexual health. Dr. Johnson did mention that quite a few men will present to a physician if there is some issue as it relates to the functionality, their sexual functionality, their sexual performance. So my question to the both physicians, and I guess we can split it up. What are some key indicators or things that men should be looking to, or should be aware of, as it relates to maximizing their sexual health? And you can speak to young men, middle-aged men, older men, all categories and ages of men in your response. But from the physician's perspective, from the medical perspective, what are some of the things that men should be definitely looking at? Who wants to who wants to take
Okay,
that
well,
first?
I could get started. I know that the question is very direct with regards to sexual health, but I want to preface it by starting with the fact that your first priority should be overall wellness, right? The World Health Organization's definition of health is very specific, but also very broad. That it's a complete state of physical, mental, spiritual, and social well-being, and not merely the absence of disease. And the body is such that you cannot be considered healthy if you're only focusing on one aspect and ignoring the other. So it's important, especially given our nature as men, and the roles that we take up in society. It's very important to that we focus on overall wellness, getting enough sleep at night, drinking enough water, pursuing a balanced diet of enough proteins, carbohydrates, and reduction in cholesterol and so forth to increase your overall wellness. But the other thing too is that we have to be conscious of the chronic non-communicable diseases, most common in our population being that of diabetes, hypertension, hypercholesterolemia, hyperlipidemia. These chronic non-communicable diseases, they have, yes, the macro effects. For example, diabetes causing your sugar to be out of control, etc. and stuff. But the greatest fear really should be the micro effects, the microvascular effects, the effects on the small vessels that, for example, are important in your sexual health as a man in terms of your functionality. So it is one of the ways in which, looking at your overall health would help with your sexual health because
Mm-hmm.
there's, you know, there's connection between, broader non-communicable diseases and sexual health. So that's where I would start pursuing things to improve your overall well-being.
Doc- Dr. Brewster, Dr. Brewster, you're breaking up a bit there. Okay, yes, I think you had a little internet difficulty there at the end, but I heard the some of the last points that you were making, the focus on overall health being imperative for different aspects of health to
Mm-hmm.
to work out. So, Dr.
So,
Johnson.
yeah, I like the way how Dr. Brewster sort of pitched it,
Mhm.
because at the end of the day, I mean, you're you're one person, okay,
Mhm.
and you have to look at the whole holistic health. If you want to look at your sexual reproductive health, for instance, if your mental health is not good, if you have a mental disorder, you're not relaxed or you're stressed out, okay,
Mhm.
that eventually is going to affect your sexual health.
Right.
Okay, it doesn't matter how good you think you can perform,
Mhm.
but if you're stressed out, you're under depression, you're not you're not sleeping well, that is
Mhm.
going to affect your sexual performance as well.
Mhm.
If you're drinking a lot of um, alcohol,
Mm-hmm.
some men, we have a lot of persons in Dominica drinking a lot of
Drink a
alcohol.
lot of.
At the moment of drinking alcohol, yes, you feel good. You might get, you might feel pleasurable at the time, and at that moment, you might be able to perform well. But then alcohol, the use and abuse of alcohol eventually is going to affect your sexual health.
Mhm.
If you are on drugs, okay, abuse of drugs, whatever drugs, illicit drugs that they are, and we know them, that eventually is going to affect your sexual health. If you're not eating right, Dr. Bruce alluded to it, not alluded to that, mentioned it. For instance, your cholesterol is high. Okay, your blood sugar is high. It will eventually affect the way that you perform sexually.
Mhm.
Yeah, sexually, because it's going to affect your blood vessels that goes to your penis, and how much blood that gets there to get for you to get a good erection, for
Mhm.
instance. Okay, so the whole question of sexual health cannot be looked at in
In
isolation.
isolation,
No.
okay.
And I should mention one of the other critical public risk factors to your general health, to having bad health, is the idea of smoking as well.
Mm-hmm.
Okay, so if you're smoking cigarette, it's going to affect your general health, and it's going to affect your sexual health. So looking at sexual health, in treating sexual health, then one has to look at the whole human being, at the whole man, in
Mhm.
terms of how everything else impacts on his health and will eventually impact on his sexual health.
Mhm.
Yeah.
Something I think that's very interesting. Two things. Something that Dr. Brewster said, he mentioned the vascular tissues, so those small vessels, and Dr. Johnson mentioned the blood flow to the penis itself. And if you understand, the male genitals, it's amazing how the penis functions, how an erection is achieved. So if you have issues starting with that circulatory system, all these vascular issues, it's definitely going to impact, if we're talking about erectile dysfunction how the penis works. So when we come back and we're backtracking, and then you kind of get the link through everything. If you have high cholesterol and those arteries, those vessels are being damaged, clogged up, then you have all this strain on your vessels. And if you're talking vascular and the penis, then you can then join it together and then make it make sense why you would have a dysfunction in, genital. So it's important, I think, for men to understand how your body works. I've had someone come into the pharmacy and he said that 3 years ago they had given him diabetes medication, and they told him, they gave him some pressure medication. And mind you, if I asked him if he has diabetic or hypertensive, he told me no, right? So he told me he had gotten some medication, but he didn't feel like it worked, so he stopped taking it. And that was 3 years ago. What brought him to the pharmacy was because he was having some excessive tingling and, pricking nervy sensations in his extremities. And more than likely, that was probably because of, the nerve damage caused by the diabetes. Right. And then you have this, let's say with this, you might notice some difference in your sexual health, and you're just not sure what is happening. You understand? You just realize maybe you cannot achieve an erection, but everything is kind of tied in where the body is concerned. And the more that we know that, and the more that we learn that, the easier it will be for us to take care of ourselves and avoid those things.
And I wanted to kind of bring in, as you spoke, Leon, and as Dr. Johnson had also said something prior, if there is a sexual performance issue, I think the first thing, or one of the first things somebody might want to do is get something to help with that issue.
For sure.
But I want to ask here about the wisdom behind that, taking into consideration all the overall health factors that you all have indicated that, of course, can contribute and are a part and parcel of sexual health. If somebody is experiencing, sexual health issues, impotence, for instance, or erectile dysfunction, and the first thing they maybe think is, let me go and see if I can get something to enhance my performance. From the doctor's perspective, what would be the better route of action? If you've noticed as a man, you've been experiencing certain issues.
But first of all, I think one has to look at what's the underlying what's the underlying factor. It might, so you need to sit with
a doctor,
sit with the client, and get a good history from him. Because as we said, for instance, it doesn't matter how good you think you are. If you are stressed out, or if you're not in good terms relationship with that partner's spouse, and you're under a lot of stress, then you will not perform sexually well. Okay. And therefore, the issue is not just taking the medication, but solving what is the underlying problem. If, for instance, the other thing, because of the damage to the microvasculature in your penis, because of high cholesterol, because the diabetes is not controlled, then the question is not just taking something to make you to perform better. You have to try to treat what is the underlying condition, so that you could solve the problem. Okay.
Now,
yeah, just to add to that, definitely so. And a lot of times it's not. Sometimes it's simple things. Sometimes it's more complicated things, doctor would say. But we've had a lot of persons come in who, and again, I think it goes back to the social aspect. If you have an issue, especially when it comes to erectile dysfunction or premature ejaculation, we see that a lot. So you'll probably come into the pharmacy. You most likely will consult with your friend first, and you will get an idea of, hey, I know this thing, and they'll come in and they'll buy it. But sometimes we always have these conversations, because we've had persons who come in and it's stress that's the factor, or they'll tell you, well, they didn't have this issue before, but their relationship is rocky, and then we have that factor. We have other persons who may be taking supplements, who maybe, they're gymming, they're doing certain things, and, taking excessive amounts of certain things that are then causing erectile dysfunction. You have medications that can do that as well. So there's a lot of different factors that can come into why you're having any form of difficulty. And one of those that's often left out is persons who have high arousal, and then you have that premature ejaculation, or there are things that can be used to treat that, like most other things. However, we need to figure out what is causing your issue? Is it psychological? Is it mental? Is it physical? Is it that you're having maybe a period of grief? What is the issue that's causing that issue?
Hmm. Yes, Dr. Brewster has been having some technical difficulties. I hope to get him back shortly. But before we continue, let me just open up the lines. I know our listeners may want to interact with the doctors who we have. Our numbers 449-3095, 449-3096, 449-3097. 616-4257. If you're calling from overseas, the number is 4-305-432 9624. Dr. Johnson, in some of the discussion so far, we've brought up the aspect of overall health, yes, and the impact of certain non-communicable diseases on the overall health of the individual. Diabetes has come up quite a bit, hypertension, hypercholesterolemia. So we've been talking a bit about, some of these things, some of these indicators, some of these non-communicable diseases that can have an impact on overall health. What is of major concern, at least from your perspective, your practice, for men in these issues that we have discussed, and what would you recommend in terms of screening, checking for these things? I am interested in the recommendation for screening for the non-communicable diseases.
Yeah. So, I mean, as you write, what you describe is a set of disease conditions which we refer to as non-communicable diseases. So you have like ischemic heart disease, that is when the muscles of the heart is not getting sufficient oxygen, burden oxygen, so the muscles become weak. So that patient could present with pain or fatigue, okay, or just general tiredness. You also have the hypertension, which is actually a silent killer, and you have a number of persons, and in Dominica and in the region that's suffering from high blood pressure, hypertension, diabetes, okay, lung disease, lung disease, yes, because of the high prevalence of persons smoking, and prostate cancer. So these are the conditions that most persons, including men, are dying of, and the number one killer in terms of cancer among men in this region and in Dominica would be prostate cancer. So a lot of persons, particularly men, won't generally just check their blood pressure because they will think, or they're saying that they're feeling fine, they're feeling well, right? Oh, doc, nothing. My pressure is okay because my head is not hurting me. All right. When you put when you check the pressure is actually very, very sky high. Okay. Or you do some blood checks for them, and you realize that the blood sugar is also extremely high. And then you do further investigation, and you find out that they're actually suffering from diabetes. What you find happening sometimes is a lot of our men, they're not religious in terms of how they take the medication.
Okay.
Or some believe that the medication going back to the sexual health could cause loss of sex drive. Some of them can, but a number of men would not take all of the medication, at least how you prescribe it, because they'll read up a lot of things on the internet. And they say, doc, but I'm not taking that because, look, that's causing that side effect. Okay. At the end of the day, what I advise men is, for instance, if you don't take your medication for controlling your blood sugar and your blood pressure, and you get a stroke, when you get a stroke, then you still can't do it. At that time, you can't do anything. All right, you can't do anything, and which is worse, not taking your blood pressure medication and getting a stroke. And sometimes some persons do not recover well from a stroke. Some persons do get some of them do become bedridden, and when you become bedridden and all of the other complications, dependency, that depends on that. Now you have to be using when they're bedridden. Some of them have to now be using a catheter. A catheter, that's a urinary catheter. And when you're using a urinary catheter, it's
a risk of infection,
risk of
motor
infection. But at the same time, what you're thinking of in terms of your
sexual performance.
I mean, you can't have sex with a catheter with a catheter, urinary catheter that you're using. So it's important that I think our men do understand that. I mean, there's what they call essential hypertension. So most times, 99% of the times, doctors will be able to tell your pressure is high, but as to what actually is causing it, we know that it's related to a number of risk factors. It might be because of high cholesterol. It may be because of you have an issue with your kidney or issue with your thyroid gland, etc. And those conditions sometimes are treatable, but 99% of the time, whether it's in Dominica, whether it's in the United States, whether it's in China, regardless of where you are, most doctors won't be able to tell exactly what is causing the high blood pressure, but will be able to treat it.
Okay.
And as we said, prostate cancer is the number one killer among for cancers in Dominica.
Yeah, for men.
And we always encourage men to do screening, especially if you're above the age of 40. Simple screening in terms of a blood test, which you call the PSA, and a digital rectal exams, with an examining that patient. And the only way you could do that physically for now is for gloves on your hand, using a finger, then examine the patient through his back passage, where you could actually determine the size of the prostate, whether it's nodular, whether it's painful, etc., and advise accordingly. Okay, and
now, I was just going to ask Dr. Johnson, how frequently should screening continue? So after the age of 40, annually?
Well, it depends. It depends. For instance, if it's normal, then annually. But if you get a PSA that is high, or the ultrasound show that is high, then it could be less frequent than annually. It could be every 6 months. It depends on what the results show.
Okay. So we talking, of some of the common, I want to call them health threats. Men specifically, prostate cancer. We see high incidence of that in terms of cancer, forms of cancer affecting men, prostate being the highest. Dr. Johnson.
Well, in terms of
cancer, right?
Yes.
And then, of course, Dr. Johnson, you spoke to hypertension as well, and diabetes. Dr. Johnson, you made an interesting point as it relates to medical adherence, and people, men sometimes want to not adhere to medical regimens because of fear of impacts on their sexual performance. And I think the point that you made that's so critical, and I hope the listeners heard it, is that if you don't adhere to medication and then you have one of the major health events occurring, like a stroke, then what you were not taking the medication for becomes null and void anyway. You won't be able to, if you're bedridden and you have a catheter inserted, you won't be able to have sex. If you die, there'll be no consideration of sex at all. So the adherence to medical regimens, and I think that's a major concern, even for me, just talking in general to people. I spoke to someone just yesterday who the doctor had prescribed something for him, and he said, I'm really not good at following all of these taking medication thing 2 times a day. You know what I mean? So I hear a lot from people, men. I would say a lot from them as it relates to adhering to medication.
Adherence to medication, and that's not just among men. Let's be honest. Adherence to medication is always difficult. It's always an issue, and especially when you have a lot of the will tell you when you have a lot of medication to take and medication to take for life. So adherence could be an issue. In fact, there are studies that have shown that in terms of when a doctor prescribes medication for an individual, for a set of for his patients, his or patient that is, 50% will take it as the doctor says. Another 1/3 will take half, another third will not take it at all. And that's not only that's not only in Dominica. It has to go a lot with the doctor-patient relationship. And some people do. Some people, especially as you get older, will forget.
Yes.
Especially the elderly, the adults. Because if you're taking a medication every day, for some chronic condition, then sometimes, because of the fact that it becomes so much of a habit, then you, at 12 o'clock, you might think, oh gosh, I took the medication in the morning, but not realizing that it's yesterday morning you took it. That you took the medication. So some people do generally forget, but some people deliberately forget, or they tend to, what you call, titrate the medication. They will say, boy, I'm not taking all that now. I'll take half. I'm taking 2. I'll take 1. I'll take 1 instead. And again, it depends on sometimes the effect or the side effect the medication might have on this individual. So patient adherence to medication it could be a significant issue, a significant problem, and adherence to medication could even be more significant, particularly if the patients have to buy everything.
Yes.
Okay, so let's face it. I mean, it's one thing getting the medication free. A doctor will prescribe medication for you to take. Let's say everything comes up to $100 a month. I mean, a farmer probably can't afford to buy all of this medication every month. Okay, so he'll go to the pharmacy and tell him, okay, give me for 2 weeks, and then that's what the money can buy, and then he might not be able to buy for the other 2 weeks in the month. Try to stretch the money to buy the medication if they don't get that medication free. Okay, so the number of reasons, the number of why patients why there's poor compliance to medication. Particularly some patients, for instance, if they want to drink, they want to go out and drink, they want to take the medication because they know that the alcohol and the medication are not good. So boy, I'm talking about that. A lot of patients, men, women, a lot of persons put their medication aside when it comes to Christmas or on Christmas. This is not just past it, because I want to eat my cake, I want to eat for those persons who eat in their ham, they want to eat all of those things, they want to drink the liquor wine, and they're not going to take medication because the medication they think will harm them by taking it. Okay, and they know it's not cannot go together, and therefore so in January you'll find out a lot of persons are blood sugar, blood pressure.
High.
Yes.
What about carnival though? And carnival too. Yes.
Yeah,
I would assume carnival is another culprit.
I go not with my friend. I'm not going to take that medication. I want to drink my little thing. Okay. So those are some of the issues that we have to be dealing with. Okay.
Yes, I think we've gotten back, Dr. Brewster. Dr. Brewster, I know you dropped off for some time. I don't know if you.
Sorry about that. However, I was following the discussion as I was relocating, and I was very glad to hear you all talking about adherence, because when I hear adherence, I get excited because that was really the subject of my research for my master's in public health, and really and truly, first of all, it's not necessarily a men-only issue. The study actually showed that there was not necessarily a difference in terms of adherence, between men and women. However, what it demonstrated is that it's not necessarily an informational issue. It is a behavioral issue. So definitely there needs to be more studies in terms of cultural factors. But for example, what it showed is that persons who actually followed a routine were more likely to be adherent to their medication. And persons who, for example, took herbal medications were less likely to be adherent to the medication that they got from the doctor. Persons who would adjust their medication because they thought that their chronic illnesses was controlled, or persons who would adjust their medication because they just can't be bothered with taking more medications. These people are less likely to be, non-adherent. So it's really a behavioral change that we definitely, want to look to our men to help to change in terms of, adherence to medication, because it's a very important part of overall health and overall management of chronic illnesses.
I want to tease this medication adherence thing a little bit. Of all the reasons, and both of you all have given reasons, very valid reasons. Finances being one, financial ability to get medication, routine. Dr. Brewster, you mentioned, and lifestyle, behavioral reasons. I want to tease both of you, particularly as it relates to antihypertensive medications. And of all the reasons that you all have given why people may not adhere, for men specifically, the adherence issue that I hear a lot from them is that they don't want to take something that they feel will interrupt their sexual performance. They don't also want to take something that will interrupt their ability to drink alcohol. I've heard that specifically. As a physician, if you have somebody who is already telling you, I don't think, doc, you're prescribing this, but my partners told me, when they take their antihypertensive medications, or when they take this medication, it cut their whooper, it cut their ban, whatever it is that people say colloquially, so you already have the feel that the man is not going to be adherent for that reason. How do you navigate that as in that doctor patient conversation with the man? So I want to ask that specifically as it relates to men, and that reason for non-adherence to certain or to antihypertensives.
So
Yes.
that's definitely true. I mean, so that's a major issue. Men will sometimes will not take the medication because they believe that it affects how the sex drive. Okay, and there are some medication which does that, so you can't hide it from men. And if you try to hide it, they'll Google it, they'll go on the internet, and the internet will tell them even some of the side effects of it. So what they tend to do, at least in the practice, is try to find a medication, an antihypertensive. Okay, there are a number of things you have to juggle with in terms of affordability, in terms of availability as well. Okay, and give that prescribe a medication that probably has less side effect, which affects your potential. But the other thing that you have to be realistic, as I indicated earlier. If you don't take the medication, then and your blood pressure goes up, okay, you'll get a stroke. Okay, you will get a stroke, and if you get a stroke, then you might become bedridden, as I indicated, and you might end up having to use a catheter. And in any case, you're not going to have sex. So choose which one you want. Okay, choose which one you want. Okay, and the same applies for, let's say, for diabetes as well. Okay, if you don't take your medication because you think, okay, there might be some side effects in terms of affecting your potency, but you might end up damaging your kidney. You might get into renal failure. When you get into renal failure, everything, the body shuts down, and then you become it was for you. You become more impotent at that. So you have to have an honest conversation with your patient, and give them what the options are, and speak very frankly to them as to what the complications might be as a result of not taking the medication. Okay, but at the same time, trying to get a medication that there's some that have more side effects in terms of how it affects your potency or not, and therefore you try to get a medication that has less side effect. One of the things I would say again is the mind could control you, because you could prescribe a medication that has very little side effect in terms of affecting potency, but the man thinks that it's going to, and therefore his mind controls it. He takes it and he thinks, okay, boy, that medication, his mind tells him that is not, he's not going to perform when he takes the medication.
And wouldn't mind telling him that.
Yeah.
What about the idea of he takes the medication and he stresses himself so much
Exactly.
that he does not perform well, and now he
Yeah.
convinces himself
That's
that
the
is the reason. So all
medication.
of those things factor in as well.
Mhm.
Yeah, it is. I mean, the truth is, well, how I approach it is that I think of it as the greatest antidote to misinformation is information, education. So I think it starts first of all with a good relationship, a good doctor-patient relationship. You know, men would be more comfortable to speak about, you know, their sexual and reproductive health with a physician that they are acquainted with. But also too, you do find some persons who prefer to speak to a stranger. But whatever it is, as a physician, you have to educate the patient on what the realities are. And you know, you prepare them ahead of time so that they know, okay, if they experience X, you come back to us and let us figure it out, use a different option, that sort of stuff. And then the other thing too is that, you know, sometimes, as mentioned before by Dr. Johnson, is these fears that come from, you know, whatever people hear or what they see on the internet and stuff, that can also interrupt the mind-body connection and also affect libido and for sexual function as well.
Okay, I know Dr. Johnson has to leave us a bit early. Dr. Johnson, I will give you the last comment on that particular issue and the overall topic before I I say goodbye to you a little earlier than the time that we have.
Yeah. Well, I mean, we spent a lot of time discussing the whole idea of sexual reproductive, sexual health. But one of the things you in starting the discussion, one of the things that you did was to basically ask the question as to what are the general things that men come to see a doctor for, or common problems that face men. And before I actually leave, one of the things I wanted to mention is that in terms of this discussion on men's health in general, in men's health in general, is the idea of suicide. Okay, mental health, suicide. We see in Dominica for the last couple, a particular actual suicide in men taking place, and the data shows, for instance, general that whereas women may have more attempts, more ideation, more plans to commit suicide, they actually are committing a suicide, killing themselves happens to men. So that's one thing I would like to and therefore it's a sign that men are calling out for help in terms of mental health. The other thing I would say also is the idea of interpersonal violence. Okay, interpersonal violence is not to live on from you. I mean, people don't fight and fist fight these days. You know,
it's guns and knives.
So that is become. We lose a lot of our men. We're talking about men and men health. We're losing a lot of our men as a result of this interpersonal violence, and that is something that, I mean, we probably would have to have another discussion on that.
Yes.
Sometime in the future. So finally, what I would love to say in terms of probably some recommendations in terms of addressing it, men in general should realize that the need, like women, like, okay, to have general checkup, even if they think they're feeling fine. Okay, cut out in terms of the consumption, or reduce the consumption of or abuse of alcohol, because it's going to affect you. It's going to affect almost every part of your body. It will affect your heart. It will affect your gut system. It will affect your liver. Okay, it will affect your sexual health eventually.
Judgment as well too.
And your judgment, mental health. Great. Right. So you by end up going and drive and you think, boy, you can fly that car. Right? And you do try to fly that car, then you know what happens. Okay. In terms of consumption, the use of abuse of drugs, illicit drugs, and especially the white substance, the cocaine, the sniffing on that. And tobacco, the use of tobacco. And eat well. You need to, I mean, that could be a whole discussion or topic by itself in terms of what you eat. Interestingly, I think I mentioned it some time ago, I'm not sure on this show, all of us heard about Steve Jobs and his dying bed. One of the things that he said is that if you don't eat, you'd have to eat, you'd end up eating medicine for food for food if you don't eat properly. Okay, so you need to eat well in terms of what you're eating. Okay, so those are some of the final thoughts that I would like to leave with you, and I'm sure that I have to depart before the actual show finally ends. But it's always a pleasure to be with you, Miss Trudy, Christian, and the other co-host,
Leona.
and my colleague.
Dr. Brewster.
I certainly know his mother and his father very well. He's the son of a mayor and a very, very, very prominent nurse, Nurse Brewster, my friend Nurse Brewster in Portsmouth. Okay, I hope we can get to meet on the show sometime again, Dr. Brewster, and to meet you in person.
Definitely.
So I'll leave the rest of the
Yes.
parties for you to take.
Yes, you'll leave us to end up. But Dr. Johnson, thank you so much for your time, and thank you for being on the program. You have really kind of dropped the hint on what we plan to continue discussing as it relates to mental health. So mental health definitely is next on the agenda. I hope to bring in psychologists, psychiatrists as it relates to that, mental health in men, and also that violence and that we also see in some social aspect of health as well will be our next topic. So you've kind of let the cat out of the bag, but that's okay. We'll continue the discussion at a later time. Thank you so much, Dr. Johnson. Thank you. So we actually don't have much more time on the program. We have the time remaining though with Dr. Brewster, who really gets this time because he got cut off for a bit. So now he's back with us. That's good. Dr. Brewster, I know we've gone through the whole gamut of as it relates to medical adherence and how you all both physicians would speak to their patients and so on. One of the things I wanted to touch on a bit, we don't have much more time, but I wanted this aspect of physical health, strength, performance, I would call it, of men. I know from being in the gym, I know a lot of men are concerned about their physical, physical structure, muscle building, physical performance, strength performance, athleticism for some men. And then there are all these things that they may take to enhance that aspect of their lives, So there are all these supplements, not just supplements, but the steroids for bodybuilding or muscle building, and a lot of people are into a lot of different things to try to maximize that. I wanted some comments from you in terms of just general physical strength training and advice to men in that regard as it relates to their well-being, overall well-being and health.
Okay, so first of all, strength training tends to be important to men at some point in their life. And so it's important to, first of all, ensure that you go to your doctor before you start strength training. It's always good to get an understanding of what your baseline physical, state is. And that would also help to inform, if there are any limitations that you should be aware of to avoid some of the risks that are involved in strength training. For example, muscle strains and so forth. Hernias, if you've had a hernia before, especially an abdominal hernia or an inguinal hernia, it's important to get clearance from your doctor before you get started with strength training, because weightlifting can increase your risk for development of or recurrence of a hernia. So it's important to get a wellness visit done before you start. Also, it's important to ensure that you start off, light. You don't try to, act like Hulk on day one. It's also important to, highly advisable to get a trainer, at least in the first instance, or work out with someone who is competent, has been doing this for a while, to ensure that you're, using proper form when you're doing strength training, because you can cause lifelong damage to muscle and other soft tissue if it is you're not doing things properly. Hydration is very important because when it is you're doing strength training, you're essentially breaking down muscle fibers, injuring yourself, so that your body can heal itself and be stronger than it was before. It means that in the process of doing that, there's breakdown of byproducts of cell degradation and all this sort of stuff that can be toxic to your kidneys, right? So you need to ensure that you're drinking enough water so that you're getting rid of these toxins. There's actually an underdiagnosed consequence of weightlifting, which is called rhabdomyolysis, and it is just a very extreme case of soreness. But the danger of it is not even so much the extreme muscle soreness. Sometimes you lift weights, especially when you're just starting, and for a few days you almost cannot move your limbs, or so forth. What can happen is that the byproducts of the muscle actually breaking down can be very, detrimental to your kidneys. And so really and truly, the treatment for that is copious amount of IV fluids. And that is one of the very underdiagnosed things, because people just figure it's just muscle strain or muscle soreness, but it can be very life-threatening. And as you know, if your kidney is affected, that can cause hypertension and cause that entire circuit. So the takeaway really is go to your doctor, take it slow, get guidance as you start, keep yourself hydrated, and stay away from steroids. Steroidal injection without medical guidance is very dangerous. So yeah, things like creatine and BCAAs and branched chain amino acids and so forth, those are generally safe. Supplementary protein safe, but always consult a doctor, especially when you see those weird and wonderful things that pop up from time to time.
Mm-hmm. Yeah, all of these and all of the trends as it relates to physical fitness, I guess seeing your doctor will allow you to know what trend you should and shouldn't follow based on your own personal circumstance. So it's not a one size fits all. A lot of people that are into social media, like if you decide that you want to strength train, you just start getting advice on social media. Like every year, of course your feed starts to become tailored to that interest, and so it's advice from influencers all over the place. But I think that Dr. Brewster, you've mentioned it, you've stated it very well, that consultation with the doctor is critical, because your situation might not be somebody else's.
And I think it's so important too, the point about the trainer or somebody who is well versed in the area, because like you said, social media, all of these different supplements, the ones that are deemed safe, like the creatinine and the BCAAs, that's fine. But sometimes you look at it and you see this person taking, the protein powder, the creatinine, the BCAAs, the glutathione, and you just go and you buy everything, and you start off using everything. You're not sure when you should use BCAAs. You're not sure when you should use, these things. So it's important that you do things gradually, as Dr. Brewster said. And you can also manage to strength train and build muscle without, additional support. So you can do that, or you can go through it step by step. You need to learn what the different supplements are for. And of course, that's what we are for in the pharmacy as well. So you can come in and learn what the different supplements are for, what you're trying to do, if you're trying to build muscle, if you're doing a lot of aerobic stuff, if you're doing strength training, if you're doing cardiovascular workouts, what would be best tailored to the goal that you have in mind, and also keeping in mind your general health and any underlying conditions that you may have, what you can and cannot take because of these things, if you have any medications alongside with that, those concomitant things. So it's important that you speak to a healthcare provider before, you just jump into full engagement with all these different things.
Dr. Brewster, we are at the end of our time, but I definitely want to give you the opportunity for last comments. I know as a young man, you may have things that you specifically want to mention in your closing as it relates to young men, what you want them to pay attention to as it relates to their health. So I will give you the opportunity to close. When we have a lot of things to discuss, the time just runs the time just runs away, but we are at the end. So Dr. Brewster, I'm handing over to you for some closing remarks.
Okay, so as I close, I'm going to leave a nugget of advice for each category of men, quick and
Good.
fast. First of all, men's health is everybody's business. It is as much the man's business as it is the women in their life. And so I'm speaking to everybody, not just men, that we need to encourage men. We need to encourage each other. Women need to encourage men to pay attention to the health. It is better for the individual, it's better for the family, it's better for the society. Adolescents, you need to pay attention to your hygiene, right? Get in the habit of using deodorant. And sometimes you need to use more than just deodorant. You also need antiperspirant, because a lot of times people think that, they are the same. They're not the same. If you sweat excessively, you need an antiperspirant, not a deodorant, right? Adolescent into young adulthood. That is the age group that statistically we find persons getting STIs, HIV, syphilis, gonorrhea, all of those things, they are running very rampant, especially because of deviant sexual behavior among teenagers and young adults, right? You have to think about tomorrow, right? And so take the measures. Abstinence is key. You cannot control yourself, use a condom. Older men, middle age to older men, it's important from you hit 35, it's not even 40 anymore. From 30 is midlife. If your average life expectancy is 70, midlife is 35. Go to the doctor, not just when you're sick. When you go to the doctor, ensure that you build a relationship, that you're able to ask questions to combat the information that you find on social media. And that's really what I have to say to my last words to the men.
But Dr. Bruce, you didn't talk to the older men.
Oh, well, and the senior.
Yes.
Similarly too, it's even more important for you to ensure that you keep yourself active, right? Exercise, you need to, all you really need is about 10 minutes of exercise, 10, 15 minutes of exercise a day. It can be anything from just jumping jacks or just casually walking around the house. Intentional exercise, you do that, stay on top of your medications, get your PSA and your digital rectal exams done annually, and your colonoscopy. When you do a colonoscopy and it is good, you have nothing to worry about for the next 10 years, right? But if you do it when you start getting symptoms, then that is when it's too late, right? Most of, for example, even prostate cancer, no man should ever have to die from prostate cancer, because prostate cancer is one of the cancers that is the easiest to treat and manage. My own grandfather has prostate cancer for at least about 15 to 20 years, so early detection is key. And continuing with your adherence to your medication, going to your doctor, and maintaining a good diet and exercise. These three tenets are the key to having a long, healthy, and happy life.
I love that.
Doctor, yes, I love that. Dr. Brewster, thank you so much for that. I think that's a nice summation. And thank you for speaking to the different categories of men. For those men 35 years old, Dr. Brewster has just indicated to you this is middle age.
He definitely hit me really hard with that one. It's a realization that maybe I didn't want to get this morning, but definitely.
But I can be honest.
Yes. So start thinking of all the things that Dr. Brewster has mentioned. Dr. Brewster, I do thank you so much for giving us your time and joining us here on Health Vibes this morning. It was definitely a pleasure. And we are over time, but Q95 has not thrown us out yet. But we're signing out. Leona and I are signing out. So until next week, where we'll join you again for another episode of Health Vibes, God willing, on Wednesday, we are saying goodbye. Have a good week. And we will see you soon. Bye-bye.
Bye.
Oh, and if they play convenience, make a big difference.